These suboccipital muscles are a group of 4 muscles located on the posterior side of the skull and the neck. It consists of 4 muscles: the Rectus Capitus Posterior Minor, the Rectus Capitus Posterior Major, the Obliquus Capitus Superior, and the Obliquus Capitus Inferior. Now, all 4 of these muscles have the same blood supply of the branches off the external carotid artery, and they all have the same innervation, which is a suboccipital nerve. So now we will dive in to see the specific origin, insertion, and action of each of these 4 muscles. The Rectus Capitus Posterior Minor has an origin of the spinous process of C1, and will go to insert on the medial part of the inferior nuchal line. Its action is to extend the head. The Rectus Capitus Posterior Major originates on the spinous process of C2, and it will go to insert on the lateral portion of the inferior nuchal line. And its job is to extend and rotate the head. So for our Rectus Capitus pairing, the minor is located over the major, and the minor is on the medial part of the inferior nuchal line, and the major part is on the lateral part of the same inferior nuchal line. The minor has 1 action, and the major has 2 actions. And I try to remember this as the major has a major responsibility in the military, and so they have 2 responsibilities. So, fun way to remember: Rectus Capitus Posterior Minor is over Rectus Capitus Posterior Major. For the Obliquus Capitus Superior, it originates on the spinous process of C2, and it'll go to insert on the transverse process of C1. Its action is to ipsilateral side bend of the head, and you can remember this because S for side bend and S for superior. The Obliquus Capitus Inferior will originate where the Obliquus Capitus Superior left off, which is on the transverse process of C1, and it'll go to insert between the superior nuchal line and the inferior nuchal line. The Obliquus Capitus Inferior is to rotate the head. So there you have it, the 4 muscles of the suboccipital group, their origin, insertions, and actions, and their similar blood supply and innervation.